How do you interpret your COPD chest X-ray? Imagine looking at a picture of your lungs and trying to understand what it tells you about your breathing. That's what doctors do when they interpret a chest X-ray for chronic obstructive pulmonary disease. A chest X-ray is often one of the first tests ordered when COPD is suspected. It can't confirm COPD by itself, but it helps spot lung changes that suggest the disease and rules out other issues like heart failure or infections. When radiologists examine these images, they look for specific signs. One common feature is hyperinflation, which means your lungs are overfilled with air because airflow is blocked. This makes your lungs appear larger than normal on the X-ray. A key sign of hyperinflation is flattening of the diaphragm. Normally, your diaphragm has a gentle curve, but with hyperinflation, it flattens out because the lungs push down on it. This flattening is a reliable indicator of lung overexpansion. Another change is an increased front-to-back chest diameter. When your lungs trap air, they expand outward, making your chest look wider over time. If you have emphysema, part of COPD, your X-ray might show darker areas called hyperlucent lung fields. These darker zones mean lung tissue has been damaged or destroyed. You may also see bullae, which are large air pockets that look like black spots with thin walls. Vascular pruning is another sign, where the blood vessels in your lungs appear thinner or less dense, showing damage from emphysema. The space behind your breastbone, called the retrosternal air space, may look wider. Your doctor might also notice that the spaces between your ribs are larger, or that your heart looks taller and thinner because of the expanded lungs. Sometimes, the bottom part of your heart appears to float above the flattened diaphragm, which is called the floating heart sign. If you have chronic bronchitis, the walls of your bronchial tubes might look thicker on the X-ray. Chest X-rays are helpful in understanding how severe your lung disease is, checking how well your treatment is working, and spotting complications. However, they do have limits, and your doctor might recommend a CORT scan for more detailed images. CORT scans give a clearer picture of emphysema, bronchial changes, and overall lung health. Remember, a full COPD diagnosis combines X-ray results with lung function tests, blood work, and your symptoms. If you have questions about your X-ray, talking with your healthcare provider is the best way to understand what it means for your health and your treatment plan.